Okay.
Hi, everyone. Thank you so much for joining URL and Allstate today for the webinar that we have prepared for you. URL and Allstate are not a new partnership. We actually worked with Philip and his team on the group ancillary side of things. And when we were approached about the Medicare Supplement product, we were super excited, obviously, because Allstate is a home name. It's well known. It's respected in the community, so it's familiar. And then they have some pretty cool discounts and new things that they're doing with their Medicare supplement, besides just the rates being really phenomenal right now. So before we get started, I just want to let you know that this is going to be recorded today. It will be saved out on our website on the events calendar, so you can watch it back at your convenience. Also, there is a blue chat box on the bottom right hand of your screen. So go ahead and click that open. So if you have any questions throughout today, go ahead and put it in there and we'll address it, as we see fit or at the end. And that's really about it. I'm going to turn it over to Phil to introduce himself and go over the products with you today. So thank you for joining us, Phil.
Thanks, Christy. Want to say thank you to all the agents that have carved out valuable time to be on the webinar today. I'm excited to share the Allstate product with you. For those of you who don't remember me from the past, I'm Phil Mishler. I am the company representative for URL Financial. It's been a great history, and we're looking forward to the future. So just so we're all make sure we're in the right place. We're here today to talk about the Medicare Supplement and another senior product that we have. So let's step off here. So for those of you who aren't familiar with Allstate's history, you can read a little bit here on this screen regarding our financials. We are an A+ rated carrier by AM Best. Okay, so one of the things that gives us an edge right now before other carriers copy us is we offer stackable premium discounts. And I think I'll show you all of them in a moment, but basically the two that are the strongest is a 7% roommate discount where the primary insured lives with someone over age 50 who's not enrolling. And then another strong discount is our 10% annual pay discount. I've been in the business quite a while. I've never seen an annual pay discount that rich. We have adjusted our commissions upward not too long ago. We're an unusual carrier in that we do offer any day effective dates, so that every once in a while that would come in handy. Maybe if there's a rate bump coming on, I'm just making this up, on the 1st of August, you have the ability to put an app in for the last day of July and avoid that. Currently, we offer several ways to sign the policy, with the easiest one being security questions. So today, we have security question. If you choose that option, you're basically asking the customer, hey, what is your mother's maiden name? They say Smith. You type Smith, policy signed for. Customer's not looking for an email that they can't find. I'm sure you've all been there at one moment in your lives. We are moving to a PIN system. So I believe it's next month. A PIN will be generated and sent to the customer, and all they have to do is read the PIN to you. You type it in, policy signed for. Here at the bottom, you can see we offer Insta Decision, which is similar to some of our competitors. Insta Decision means that if you are submitting an underwritten application, about 85% of the time, we can instant issue it. And once it's instant issued, immediately you can go in and download a temporary ID card, and your customer, if you meet with them personally, could walk out of the meeting with an ID card. And you know how consumers are. I have insurance if I have an ID card. So agents seem to like that. Let's continue. Okay. So some of the other discount that I didn't mention is activity tracker. So if your customers have a Apple Watch, a Fitbit type device, right now, if they just simply connect it to our system, it's a 5% discount. I did already mention the annual pay discount, and these discounts can stack on top of each other up to 25%. Okay, there's the household discount that I spoke of. And then similar to some other carriers, we have a dual household discount of 10%. So I think you get what I'm saying here. Okay, so we have product in just about every state except for Washington State and basically New York and New England. But as you can see, in the light blue states, these are all multi-discounts. So everything that touches Pennsylvania is multi-discount with the exception of New Jersey. New Jersey was only approved us for 10% dual applicant discount. Okay. What we offer that's also unique is for underwritten products, we offer what we call preferred select. And for a preferred select customer, they're going to start at a lower rate than our other underwritten policies, and they maintain that lower rate throughout the life of the policy. And I do just want to backtrack 1 second and let you folks know that that's the same thing with the premium discounts. They don't go away after the first year. Those premium discounts last the life of the policy. So here at the bottom of the screen, you can see preferred select, some of the criteria that would fit. So if you have a customer who is just, for lack of a better way to say it, they squeak when they walk, they can get a much lower rate with us that stays that way over the life of the policy. Okay, so we offer the following plans. Obviously, you folks are familiar with these plans. Currently, I'm sure most of you would agree, most of our business comes in at Plan G, and occasionally we have agents submitting High F or Plan N. And of course, if your customer was pre-macro, then they could buy Plan F if they choose to. Okay, well, this first bullet point, you obviously know there is no network your customers must use with I think most Medicare supplements, if not all of them. All of these features are pretty standard features, except for the last one. For Medicare supplement customers, we do add in a hearing benefit that's a real deep discount with Amplifone, and I believe I have a slide coming up on that. Oh, okay, it's coming up right now. So Amplifone, if you're not familiar with Amplifone, they've got quite a broad network across the country. And what it does is, I don't know why it says risk-free 60-day trial. We are giving this to your customer for free. So we probably need to change this slide. So here you can see, I think the biggest thing on the screen right now is right here in the middle where it says 60% average savings off manufacturer suggested retail price for hearing aids. That's a steep discount. And I think that most folks who are buying our Medicare supplement would appreciate this benefit. And here at the bottom, you can see there's some other benefits that come along with this feature. 1 year of free follow-up care, 2 years of free batteries, and a 3-year warranty with loss and damage protection. So some of you might be wondering, what is our a gym benefit? So there's several gym benefits here. The first one is at no cost, we offer your customers on-demand fitness videos. And then for those who actually want to leave the house and go somewhere to work out, we do offer Active and Fit, gives your customer over 10,000 fitness centers that they can join. And the discounted price that they pay is $28 for the gym membership. And it's all the places that you folks would be familiar with as far as the gyms themselves. Okay, let's take a look at some plan details. So This is pretty standard stuff. I'm not going to read it to you. If you're currently a Medicare producer, you know all of this. But we do entertain all these types of Medicare customers. It's pretty much the same as before. It's everywhere except New England and Washington State. And just because you folks are in central Pennsylvania, it's important to note that our rates in every state that touch Pennsylvania are very competitive. So Ohio, West Virginia, Maryland, Virginia really doesn't touch Pennsylvania, but we're very competitive in Virginia, Delaware, and also New Jersey. So once your customer is enrolled, we have a website where they can go. I'm sorry, this is for agents. So we have a really simple website. At the end, I'm hoping to run a sample quote and show you how easy it is. I've been around a while. I've never seen an easier senior website to navigate. And I know that's a big statement for a lot of you, but the proof's in the pudding. I'll show you, and you can judge for yourselves.
And Phil, I just wanted to let you know that I am here.
Okay. Oh, good. All right. Do you want to take over, Jen?
Sure, that's fine. That'll work.
All right. Thank you. So let me just introduce Jen. If you don't see her credentials, Jen is our senior specialist. Jen has been in the business for over 15 years, and she controls all of our senior products from our territory and is a great resource. At the end, we have a team sheet that I'll pull up. Any one of us can help you, but Jen specifically is a wealth of knowledge. Okay, Jen, take it away.
Awesome. Thanks, Phil. Thanks, everybody. Pardon me for joining a little bit late, but at the end of this presentation, like Phil said, we'll show you the e-apps. You can quote and enroll in one place online and actually have access to instant ID cards and instant decisions as well. All right. So as far as payment goes and effective dates, we'll actually do any day effective dates as long as their Medicare Part A and Part B is effective. So if somebody needs to, let's say their Part A and Part B, Medicare Part A and Part B was effective June 1st, they can get tomorrow's effective date. So gone are the days of just the first of the month effective dates. We can actually get them tomorrow's effective date as long as they sign the application today. The e-app or any of our applications does need to be signed at least one day before the effective date. And initial premium payment does need to be withdrawn, or the date of the initial premium payment has to also be at least one day before the requested effective date. Recurring payments, we'll do bank drafts. They can occur anytime between the 1st and the 31st or the 1st and the 28th of the month, if we're looking at February. And then the form of payment that we take for Medicare supplement plans, we'll take EFT from personal check or from savings. All right, so many of you are probably already familiar with this website, but this is allstatehealth.com. So this is going to be a site that you can go, and there's a wealth of information on there for agents. If you're looking for any YouTube guidance or videos or anything like that about product training, feel free to browse this website, but also feel free to, just set a calendar invite with me. We will put the team sheet up at the end of this meeting, and you'll be able to just click on the QR code and schedule a meeting with me if you like in-person one-on-one training, or if there's a couple in your office or whatever the case may be. We'll do those. I'm happy to do those trainings, one-on-one or in a group. All right, so if you click on this Agents and Brokers tab, this is where it's going to show you, it's going to bring you to our marketing website. It's going to bring you to some of the sites that you can, pull brochures, flyers, any of that without having to log in anywhere. So this is a public-facing website. And again, you can also get, view the state availability grid and any training like YouTube training that you be wanting to look for there as well. And then for the customers, so let me just, for existing customers, right? Our website is actually, the member website is myallstatehealthsolutions.com. And within this website, they'll be able to view general policy documents. They'll be able to sync their activity tracker if they got that wearable device 5% discount. They'll be able to not submit a claim here for the over 65 products like Medicare, but they can maybe review claims, review payment, just make sure everything's on track there. But they do have access. Again, the existing customers would go to myallstatehealthsolutions.com. So we talked about this member portal at myallstatehealthsolutions.com. Register that fitness device, view policy documents, check current and past payments, check current payment method. And then, if they're like me, if they've lost their actual paper or the plastic ID card that we send out to them in the mail, they can always download a temporary ID card from their member site. You as an agent have access to go to agent back office and also download and send their temporary ID card. But again, the member does have, and they can always keep that plastic copy in their wallet, but then also, on their phone, they can download the same ID card in their phone, in their smartphone. And so just to recap about our Medicare supplement plans. So I'm not sure if Phil mentioned this or not, but we've actually had Medicare supplement plans since 2018, right? Most of you are familiar with us because we were National General before we became Allstate Health Solutions. And really, 2018 through much of 2022, we were only competitive in certain pockets of the nation. We've always offered Medicare supplement plans in 42 out of the 50 states. But currently, I would say we're very competitive in about 37 states when it comes to Medicare supplement plans. So, to recap on why you would sell a Medicare supplement plan with Allstate Health Solutions. Well, first of all, the med subs are going to help your clients protect, you're going to help protect them out of out-of-pocket expenses, whether they're in the hospital or they receive outpatient Part B services, whatever Medicare covers, original Medicare Part A and B, the Medicare supplement plan like G or N or F, that's going to help cover a lot of those out-of-pocket expenses when they use their care. And there's also multiple options to choose from. So I mentioned A, F, and high F are available for those that were eligible for Medicare prior to 1/1/2020. We also have a 30-day free look. We have the multi-discounts available in a majority of the states. Again, we have MedSup available in 42 out of 50 states. And I would say 35 plus of those states, we're offering the multi-discounts. Also, the flexibility to go to any doctor or hospital that accepts Medicare. So your clients are going to be really happy because they can go to see any doctor or any hospital facility. If they take original Medicare, they're also going to take their Medicare supplement plan with Allstate Health Solutions.
Jen, we have a couple of questions.
Sure. Absolutely.
You ready now?
Yeah.
Okay. So we'll start with Mike. Mike asked, do the discounts stay on for the life of the policy? Yes, they do, Mike. We're really excited about that. Let's see. This one, Jen, you're going to have to help me with. Mike also asked, what rate tier at guarantee issue age 65 or coming off an employer plan with proof of coverage?
Mm-hmm. Yeah. So, and this is going to be in our underwriting guide, and it could change like per state. But generally, the answer to that question is that they're going to come in for guaranteed issue or open enrollment. They're going to come in at preferred rate. So a majority of those are going to come in at the lowest rate possible, which would be preferred rates.
Okay. So Joe gave us a compliment. Joe, thank you for your compliment. Joe also has a few questions here. Jen, I'm going to be leaning on you for some of this. Joe is asking, is this product available to individuals under the age of 65 who are Medicare eligible? Joe, the answer to that question is yes. I'm assuming you're talking about Medicare disability. Joe also asks, are there any glitches for Medicare eligibles who are applying delayed Part B who have had credible coverage? He gives an example, employer coverage until an age in the future. Yeah. So I believe Joe is asking is, are there any glitches for people who are coming off an employer plan who have recently signed up for Part B? So
let me address like both of those questions. So the first question from Joe, is this product available to individuals under the age of 65 who are eligible for Medicare? We do. It depends on the state. But if we have meds up there and the state says that we do have to offer a meds up plan for those under age 65 who are on Medicare because of a certain disability, like end-stage renal disease, certain cancers, whatever the case may be, if they are on Medicare because of a disability under age 65, and if that state does mandate that we offer like a plan D, or maybe it's all the plans, those will be offered. And then the other part, the two-part question and the answer would be, are there any glitches for Medicare eligibles who are applying delayed Part B who have credible coverage? So let's say you have somebody who's, Part A was effective this month and their Part B, they deferred because they still have employer coverage. Let's say their Part B coverage is going to start like 12/1 of 2023 or something like that. They're going to still be in their open enrollment period and there wouldn't be any glitch. They would be able to get a MedSup policy with us once their employer coverage ends, but they have to have Medicare Part A and B in order to enroll in a MedSup plan. So hopefully that does answer your question.
Joe had one last question. Is this product available to someone who may?
Yes.
Yes. Okay.
So ESRD stands for end-stage renal disease. And so again, that would somebody who's on Medicare because of end-stage renal disease, they would have to come on to our MedSup plan, our MedSup plans during their open enrollment period, that initial enrollment period, then yes. But God forbid, let's say they're wanting to like change MedSup plans and they've been a Medicare beneficiary for a couple of years now, they have end-stage renal disease, they're gonna have to stay put with their current carrier unless, let's say, that MedSup carrier no longer exists or they have some other type of qualifying event to enroll with us. And then let's say Rayvon is asking, is this plan in Maryland? Yes, we do offer Medicare supplement plans in Maryland, in the state of Maryland. And then on this last part of the slide, I just want to make sure that everybody knows that there are guaranteed issue policies available with Allstate Health Solutions. This next slide. So, obviously we pay commission for when you sell our products. And for Medicare supplement plans specifically, we have a spring bonus. So we have quarterly bonuses that go on. This second quarter bonus that runs from April to June through June. In order to trigger this bonus, you must sell or you must submit at least 10 policies with us in the quarter. Okay. And then the bonus is triggered, and underwritten applications are an extra $125. If you send us any of your anniversary rule or birthday rule business in the states where those rules apply, that's an extra $50. And then open enrollment applications are $25 extra. So again, this bonus is on top of your commission that you make with us. And we will be doing a different bonus, a little bit richer for third quarter, and then again fourth quarter. Again, that tends to be when we have our richest quarter bonus at that time. And for right now, just to reiterate, in order for this bonus to be triggered, you must submit 10 MedSup policies to us within the quarter.
We do have one more question from Stephen. Can you see his question?
I can. Is there a clause for pre-existing if they did not have credible? That's a good question. And no, there's no pre-existing condition clause. So if their MedSup policy starts 7/1, even if they had pre-existing conditions, there's no pre-ex with MedSup.
All right, cool. Thank you, Jen.
Yeah.
So we have a no waiting period dental vision hearing plan. Again, I've been around a while. I've never seen a plan richer. So I'm going to share the details with you here and let you judge for yourself. Some of the benefits of this dental plan are that we use the Aetna Dental Administrators Network. The richest option includes denture and implant coverage, and the maximums for the dental plan increase the longer that your customers have the plan. Let's see, we have a little more detail here. Okay, so these are the basic services. You can see the deductibles are pretty standard. The preventive benefit is pretty standard. I always like to start with the richest benefits. So here on level 3, from day 1, I'm going to get 50% for basic. And once I make it to year 2, basic, as you can see here, is covered at 100%. So this is the meat of it. Again, if I'm looking at level 3, from day 1, I'm getting 25%. Once I crest year 2, it's at 50% for major. But you can see here, there's also coverage on level 3 for dentures and implants. And in year 2, the maximum goes to $3,000, which is quite rich. It's richer than a lot of group dental plans if you sell group medical. Let's see. Oh, okay. So please don't take my word for it. If you want to jot down this somewhat long email address or web address, you can check the scope of the network for yourself in Central Pennsylvania. But I can tell you a 43% average discount is very strong. And I understand how dental works. If your customer's dentist is in the network, it's a great deal for them. And I'm interested to hear some feedback. We have had people look at it in Central Pennsylvania, and they tell us that it is a viable network that can work for a lot of your customers. There's a eye benefit. The eye benefit is through Avisus. If you aren't familiar with Avisus, Avisus is owned by Guardian Life Insurance Company. What's exciting about Avisus is they have over 11,000 vision providers, and they have every major chain, including Sam's Club and Walmart. So if you read here, you can see there's level 1 and level 2, and you can see what they pay out. There's also a lens benefit. There's quite a few other benefits, but we didn't have the time to go through all the slides. We do have, if you go to allstatehealth.com, there's brochures. We could also send them to you on request. So I'm really excited about my team. Anyone that you're looking at right now can help you with any of our products. My team has over 100 years of combined experience in the health insurance space. The thing you really need to know about everybody on this screen right now is that we care. We care about you. We care about your customers. And sometimes in today's world, it's hard to find somebody that cares. So it's easy to talk about caring. You'll have to give us a try, and we can show you. Jen, do you see any more pictures? Or, sorry, pictures. Do you see any more questions?
Yeah. While you were talking, I just went ahead in the chat and put it in writing as well. But one of the questions is they believe that we only had dental vision hearing in PA for a year, but I believe it's 2 years now. I can double check on that for you. But we do have some experience in the DVH market, for at least a year, if not 2. And then the other question is DVH in South Carolina? And it is. And then we have another question, is DVH an extra charge on top of the MedSup premium? Great question. It is. So when you're in our quoting system, you'll see like MedSup, and then there's another product that, even if you click like apply, putting them, let's say MedSup Plan G into the cart, if you click apply, it's going to say if DVH is available in that state, it's going to say, hey, would you like to talk to your clients about DVH? And then at that point, there's one question that will give you a rate for DVH, or you can even sell standalone dental. And the question is, have you had any major services within the last year, or have you had crowns, dentures, I think also a filling in the last 12 months? If that answer is yes, your client is eligible for the standard rate. If that answer is no, they are be given or issued the preferred rate for dental. I will say also that we have a bundling discount for dental. So if you sell your customer a MedSup plan with us, and then you bundle dental vision hearing, they're going to get 10% off the dental product or the DVH product. So just wanted to say that there is, again, an extra charge for DVH, but there's a bundling discount when you sell that in addition to MedSup or even our senior indemnity. And then we have a couple other questions. I was actually asking about the MedSup longevity in PA, not DVH. Thank you for clarifying, Stephanie. So we have had Medicare supplement plans in Pennsylvania since 2018, okay? But we understand that, and that was with National General on NatGen paper. understanding that we were not very competitive in the state until just recently, right? So although we have experience there since 2018, we lowered the rates with our new charter through American Heritage Life, which is owned by Allstate Health Solutions. And so we just a little bit over a month now of experience, but this isn't our first rodeo in the state when it comes to MedSup. We've just lowered the rates through the new charter. So hopefully that answers your question there. And then for what does the data go for the wearable? Great question. I get that every day. So if you have a client that has a Fitbit, an Apple Watch, a Garmin, one of the eligible activity trackers, what we ask them to do is go to my Allstate Health Solutions member portal. They sync that tracker. They take one step. We do have, we'll collect the data, but what I will tell you right now is that we're not sending out push notifications to your clients that says like, hey, you only got 2,000 steps today, like go for 5. We don't send push notifications to them. We are also not going to issue a higher rate increase based on activity or lack thereof. So we are just keeping them honest that they in fact do have this activity tracker. And that's really the data that we're collecting at this time, is that yes, you indeed do have this activity tracker, and they'll get that 5% discount year over year once they connect to that tracker.
Jen, do you have the ability to boot up a quote?
I do.
See an icon that says share content. If you're looking for a zip code, let me know. I can give you one.
Okay, yeah. Sorry, I'm not as familiar with this platform. Oh, okay. And then we have one more question from Tony. So you are not using the date yourself? I think you mean data. So yeah, we're not using the data for anything at this point. We're just keeping them honest that yes, they do in fact have an activity tracker. And then Phil, where does it say?
Oh, so at the bottom, if you minimize your screen, go out of full, and then underneath your live feed, there's a blue
I see. Yeah.
circle. Yes.
Okay, cool.
So let's see if that works.
All right, just 1 second. Let me pull up. Okay. I just have to pull up the test environment. Give me one moment. Dual authentication. Okay, can you, oh, actually, that's not what I wanted to share. Oh, maybe it is. Let me go ahead and get back to that. That might be easier. Can you see me typing, Phil?
I cannot.
Okay. Let me do one more. Okay, are you able to see?
I don't know, Christy, can you see it? I hit some button on my computer that I can hear Jen, but I can't see the screen.
Let me try one more thing. Sorry about that. Okay, I think now, can you see what I'm seeing, Phil?
I can't, but I think everyone else might be able to. If you can't see the screen, could you chat, Jen?
Yeah, can you all let me know if you can see that? Okay, great. It's I got everybody's response that they can see it. Okay, awesome.
All right. So you'll be using zip 17111.
Okay, just one sec.
Please.
All right. 17111.
Yes.
Awesome. Okay. So just want to point out a couple things on the screen. So when you get to back office to quote the senior products, you want to click on quote senior. There is this chat feature right here. So this is awesome. I just want to point it out, especially if you're new to this site. If you get stuck on here, if you have any questions, click on this chat button because either myself or somebody else from my team will be able to help guide you through the system. So again, that live chat feature is awesome. So in order to run a quote, you just need 4 pieces of information: the effective date, the zip code, and the date of birth. And so the date of birth that we're going to run right now is just somebody who's turning age 65 in the month of July. All right. So I put date of birth 7/15/58, effective date 7/1, zip of 17111, and then I'm going to click female. At this point, you're going to go ahead and click on quote now. And then it just, the screen pops up that it says that PA is one of the new states that has been added to the charter. And then here you can see the Medicare Supplement tab. These are the products that are available in the state: MedSup, dental, vision, hearing, senior indemnity. Okay. There's also a couple things you can download the brochure. There's a hearing discount program through Amplifon Hearing that's also available. So you can download that flyer. And then the underwriting guide here is here as well. This is an open enrollment quote. So we're going to go ahead and just put in the effective date, which in this fictitious quote is 7/1/2023 for both Part A and B. All right, the next question is the pre or post macro question. Did you first become eligible for Medicare due to age, disability, or end-stage renal disease prior to 1/1/2020? That answer is going to be no. And then it's going to say fetching plans. And then you can see here that we've got plan A, B, G, and N that are available or offered to this person or to your client. So right now, these are just the base rates. Okay, so plan G, we've got a great base rate of $105.95. The next button you're going to want to click on is calculate discount. Okay, now calculate discount, the first question, these are the multi-discounts that I was talking about. The first question is, and this is what you would ask your applicant or your client: do you have a spouse or roommate that is 50 years of age or older? If that answer is yes, they are eligible for the household discount. Now, that spouse or roommate does not have to have a policy with us in order for them to get the 7% discount. The 7% household discount is just for your clients that have a spouse or roommate over the age of 50. The next question, though, for 3 more points: is that spouse or roommate also applying for a policy with us today, or do they already have a policy with us? If that answer is yes, then you can see they're eligible for the dual household discount, which is 10%. The next question is the activity tracker question. So, do you own an activity tracker or wearable device, such as an Apple Watch or Fitbit? And are you, Mr. Client, willing to share your data with Allstate Health Solutions? If that answer is yes, then they're eligible for the activity tracker discount. Next is mode of payment. So if they want to pay for their premium on an annual upfront basis, they are eligible for an additional 10% discount. So in this example, the rate began at $105, and now I've applied all stackable discounts up to 25% off. I'm going to click on Get Quotes. And then sorry, I just had to make my screen a little bit bigger because of the presenting screen. So let me move this. Here we go. Now you can see that Plan G that started off at $105 a month with all of the discounts goes down to $81.53, which is like unheard of, right? And then Plan N, actually $63 a month. So they would have to pay the annual premium of $978 or $757 in the case of Energy. But now, if you want to edit the answers, and let's say your client says, you know what, I would actually like to keep my money in savings. Please show me what that monthly premium would be. So we're going to go back to monthly, but at this point, see, look here, they're still eligible for a 10% discount. So we're going to apply those discounts. And again, Plan G started off at $105. It's still down to $90.58 per month. All right, so at this point, let's say your client does want Plan G with Allstate Health Solutions. They're going to click on Add. And then again, we have that pop-up that says, hey, make sure you're talking to your clients about dental, vision, hearing. And we're going to go See Plans. And here's that question. Has any applicant had a filling, crown, root canal, dentures, or implants within the last 12 months? If that answer is yes, then you're going to get the standard rate. If that answer is no, your client will get the preferred rate. And then again, here are the rates. These are the standalone dental rates. Okay, so you can sell standalone dental. Or let's say they want to add a vision plan. They can add the vision here. We're going to click on Add. And now you see two different plans or policies in the cart, Med Sup and DVH. And the DVH plan started off at $64, but we applied that 10% discount. Now it's down to $58.09. A couple other things I wanted to point out. You can download the brochure here for DVH. There's also this pretty slick summary, right? So once you get familiar with our DVH plans, you'll be able to kind of, pull this up, talk to your clients and show them like level 3 dental, day 1 coverage for implants and dentures and major services. The annual max, $1,500 the first year. Second year goes up to $3,000. This kind of just gives you the highlights, or of course they're calling it a summary. And then the vision. If you click on the vision tab, you'll be able to see level 1 vision, $10 a month. Level 2 vision, $19 a month. And what are you getting for that? Well, level 1 is a 12-24-24 plan. Level 2 is 12-12-12. So we're looking at the frame and contact allowance is only $130 every 24 months. Level 1, $200 every 12 months. And then more of the lens packages are going to be covered under level 2 rather than just a discount in level 1. So I really like that summary. It helps me sell. It helps you all sell. And then again, just to apply, super easy. Click on Apply. The application is going to populate here. And once you complete a section, then the radio buttons over to the left will turn green with the check mark in there. So you're going to know, I'm just going to go through this quickly so I can get the box checked off. But this is exactly like the paper app, but this leaves little to no room for error, right? This button's pretty cool. Make sure that you're emailing your client all the applicable documents. So the documents that we need to send them, it's going to be the guide to health insurance for people with Medicare, the health information form, the outline of coverage, and the notice of privacy practices. Even though this says 2022, I can assure you that we're sending the 2023 documents. So you put your applicant's name in there, their email address, and send the document to the applicant, all right? So now you can see I've completed that section, so it's going to show that it's completed. The additional comment section, this is really going to be for probably underwritten or GI applications because, open enrollment, there's really nothing to add there. But if you have, let's say you have a GI case and you need to add the supporting documents or whatever, you can do that here. You can drag and drop. You can add any additional notes to the application itself. There's the agent statement, the health info authorization section as well. There's a lot that goes into this, so I just kind of want to scroll through but show you what this looks like. General information. Since I'm in the test environment, I am going to just, we'll go ahead and call this woman Kathy Test. And you would continue to fill out this information for your client. So the social security number is required. The Medicare claim number is not required, but I will tell you, if your client has their Medicare claim number, they have that red, white, and blue card, go ahead and get that, snag that Medicare claim number right now so that there's no delays in claims payment. All the rest of this information you would get from your client, nothing new here, name, address, phone number, email address, all of that good stuff. And then at the end here, you're going to put in, let's see, let me scroll down here. How would your client like to receive ongoing communication from Allstate? I will tell you that the plastic ID card, as well as the policy packet, will go to them in the mail. But any further communication or future communication, how do they want to receive that? Electronically, through email, or through the mail? Also, where do you want the policy sent? To the primary applicant or to the agent? Then we're going to move to the billing section, right? So if you look here, you can see all the sections I still need to complete. Now, this is important. We talked about this on one of the slides, but the payment frequency, on this example, I picked monthly, and the initial premium payment is going to default to today's date, or you can set it out, because this example is 7/1. You can set the initial premium date as far out as to 6/30, to June 30th, or you can just keep it today's date, or maybe they want June 25th, whatever the case may be. This is for initial premium payment. All subsequent payments will be, let's say if they made their initial premium payment today, but their policy is effective date of 7/1, those other ongoing drafts, monthly drafts, will be taken on the 1st of the month. If they need to change that, they can call member services once they become a member with us, once the policy is active. We'll take payment from checking or savings for MedSup, and same with the dental, or dental, you could also do a credit card, but no credit card for MedSup payment, just checking or savings only. And then this last tab I wanted to show you is the plan, bill, and signing. We do have 3 different signature methods. E-signature, much like DocuSign, we would send, once completed, we send the application to your client. They sign a date, and then it comes back to us for processing. Or the voice signature, there's an 800 number and a 4-digit PIN. Your client calls that number. They put in, it's a voice service. They put in their 4-digit PIN. It recognizes your client, and then they move on. It does take about 7 to 8 minutes, but if they don't have email, that's a good option. And then we have the security question signature. That will be changing to a PIN signature later, I believe in July. But for now, the security question signature is super easy. You just select security question signature. You make sure that you send the applicable documents to your client. They pick, let's say they pick the mother's maiden name. You would ask your client, what is your mother's maiden name? They would tell you, my mother's maiden name is Jones. You type in Jones, then click submit on this application. That it's grayed out for right now, but you can see submit there, and then the policy would, or I'm sorry, the application would come to us for submission. And in all cases of open enrollment, it's going to be instant decision, instant ID cards. So let me show you what that looks like. I'm also going to, just for purposes of this demonstration, click on Save, Draft, and Exit. And then I'm going to go to the Applications tab. And this is for all of you right now. This is super important to pay attention to. On the Applications tab, in your own, quote, senior platform with Allstate Health Solutions, you'll see that Kathy test that I started, I can go here and I can view the status of her application if I've already submitted it for processing, or I can click resume in this case to finish my application, or I can click delete. So the status, you can view the status of all policies here, or you can view, like, maybe there's pending client signature, it was declined, policy issued. I'm going to click on policy issued. Again, this is the test environment, but in here, you'll be able to download a copy of the app packet, keep it for your records, and then download an ID card, right? And download the ID card is super cool, because let's say, or it does take about 7 to 10 business days for an actual ID card to be in the mail. But here you can give your clients peace of mind that, like, hey, let me just download this ID card for you. Here's your Allstate Health Solutions MedSup ID card. I'm downloading it. I'm emailing it to you now, or I'm printing it off. I'm giving it to you now, so that you can, keep that on file, and you just rest assured that you have that ID card ready for 7/1 effective date. So that is what I have at this point. Phil, should I stop screen sharing, Phil, and answer some more questions, or is there anything else that you'd like me to review.
Well, do me a favor. So somebody is asking how they see their list of customers. Could you just show them where the back office is?
Absolutely.
All right.
So from Quote Senior, you're going to click on back office. All right. Now, I'm not really going to click on a whole lot of buttons because at this point it's going to show like I have access to everything. So your name right here, instead of Jennifer Pasquale, it'll have your name. You would also just need to click on policies. Super easy. You click on policies here, and then you click on search. Okay. And then a list of all of your policies with Allstate Health Solutions are going to be there. So if you're selling short-term medical with us, those are going to be there. If you're selling, any of our U65 products, those are all going to be there. But if I scroll down here, there's actually a product category. So you can look at your policies by, you can look up like currently, like how many MedSup policies do I have with Allstate? You can just click MedSup policies, click on search in agent back office, and you'll be able to view everything there.
Jen, since you've been presenting, I haven't been able to move my cursor or go around my seat. If you want to stop presenting, I just want to sweep any other questions. Okay, so let's see.
It looks like we do have a couple questions. So let me, the webinar is breaking up. So yeah, Phil, I think that we've given a copy of the presentation. So we'll make sure to get a copy of the PowerPoint presentation. Let's see. Can we see our book of business on the site? I just went over agent back office and how to view policies. One question for Christy. Christy, will this webinar be available before the weekend? I'll leave that up to Christy, but I believe she does have the updated PowerPoint presentation that Phil and I just gave. And Christy also saying that the webinars are recorded. So we'll have that as well. Stephen is asking face-to-face signature ? So if you have somebody that's in the office with you and you're doing the MedSup application there, the face-to-face signature, the easiest one is going to be using the security question signature. And again, that's as easy as asking your client for a security question. You get the answer from them, and then you just type it in and click submit application. So really easy submission process for in-person. Let's see. Also, are you looking for a new contract, a paper application to submit business? We do have paper applications as well. So when you're in Quote Senior, there is a tab that says forms, brochures, and guides. And at that point, you can click there and you'll be able to download paper applications in that file. Again, that's under Quote Senior, and then forms, click on forms, brochures, and guides. All right, so that's all I have at this point. Chrissy, did you have any other questions? Or Phil, was there anything else that you wanted to add that maybe I missed?
No, you did an excellent job. Really appreciate you. Christy, thank you so much for setting this up, and hats off to URL. Thanks to the agents that carved out almost an hour of your day today. I think we've got a great package of products, and we'll hope that you're going to, our only ask is that you give it a try. And once you try it, you won't stop. So we appreciate you giving it that go, and just let us know what else you need to be comfortable with our products.
Yeah, great job today. Thank you, Jennifer. Thank you, Phil.
Very welcome. Thank you. Appreciate the opportunity, and I look forward to working with all of you.
Thank you, everybody.
Bye-bye.
Bye-bye.